5, 4, 3, 2, 1. Hello and welcome to another episode of the Everything Medicare Podcast. Today is July 30th, 2018. I'm your host, Christian Brindle, Medicare Health Plan expert and specialist. I'm coming to you from Sandy, Utah in our office here at Brindle Insurance Group, Christian Brindle Insurance Services. Thank you for tuning in, folks. Last week we kind of got a little bit off of schedule where we brought you the podcast a couple days late, but you forgave us. And every single Monday, I bring you a podcast where I talk about everything that has to do with your Medicare, your Medicaid, your Social Security, and everything that has to do with your retirement. And today we're talking about probably the biggest and most asked question that I have ever received since I started working with Medicare. And that is, what is the difference between Obamacare and Medicare? Why can certain Medicare plans ask health questions? I thought that Obamacare got rid of that. Why are there certain deadlines for Medicare and they're not the same for Obamacare on when I can sign up, when can I make changes? Folks, let me start this off by putting this out there and spelling it out as clearly as I possibly can. Medicare and Obamacare have nothing to do with one another. You hear me? Medicare and Obamacare have nothing to do with each other. Do you understand? They have nothing to do with one another. Obamacare, folks, is a bill for health care for people that don't qualify for Medicare. That's what it is. It's for people of any age under the age of 65 or if they don't qualify for Medicare. When you do qualify for Medicare, you don't qualify for Obamacare. And vice versa. When you qualify for Medicare, you don't qualify for Obamacare. When you qualify for Obamacare, you don't qualify for Medicare. Obamacare is insurance for people under the age of 65. Medicare is for people over the age of 65. Medicare is a program where they take a certain amount of money out of your paycheck in the form of taxes throughout your whole life, and it goes into Medicare. It's like a health savings account, if you will, and everybody's money goes into one area. They pay it back to you in the form of health insurance and in the form of paying claims once you are eligible. Obamacare doesn't have anything to do with that. Obamacare is basically an act that it's a bill put in by the government that basically has insurance companies do things a certain way. Point blank simple. They could not be further from each other. Medicare is like a program like Social Security for people to help them out when they're retired, to give them better health care, to lower their costs. It's because the government looks at it and says people aren't responsible enough to save their money up to take care of themselves when they're retired. So we're going to do it for them. For a lot of people, that's the truth, not for everybody. But it's something that's not optional. Obamacare is just regulations that prevent insurance companies from doing certain things. Before Obamacare, insurance companies could ask health questions, and they could take or not take anybody that they chose. And Obamacare did away with that. Now, is that good, bad? Well, there's good and bad to it. The good is people that have health problems can get health care. The bad thing is, not only because of this, but partially, the insurance companies are taking on everybody, no health questions, they're paying out unbelievable amounts of money, so it causes all the prices to become inflated, the deductibles to keep going up and up. So if the only way to get Obamacare and it be decent coverage is with a subsidy, and that's the other thing. Obamacare has different subsidies that the government provides it to work with the insurance companies and than Medicare does. They're just very, very different programs, folks. Stay with me, and I'm going to jump into more of this in segment 2. Welcome back. This is the Everything Medicare Podcast. I am Christian Brindle, and I'm your host where every single Monday I talk to you about Medicare, Medicaid, Social Security, and everything that has to do with retirement in the form of the Everything Medicare Podcast. Today we're talking about Obamacare and Medicare. What's the difference between each other? And like I talked about in the last segment, if you were listening, they could not be further from each other. They could not be more different. Obamacare's for people. It's a program that stops insurance companies from doing certain things and puts requirements on how they're allowed to offer health care. Just is a bill that determines what health insurance plans are going to look like for people under the age of 65. This is individual health care. But it also affects group plans, what they can look like as well, group plans through your work and work insurance. Medicare is a program that basically, like I said in the last segment, you pay into throughout your life, and it's something they if you will give back to you when you are retired or when you're age 65 or above. Medicare and Obamacare, folks, they're so different from each other. Basically, like I was saying in the last segment, Obamacare did away with health questions for individual insurance plans for people under the age of 65. But that didn't affect anything in Medicare. Had nothing to do with Medicare. And that's why Medicare supplements can still ask you health questions. Medicare Advantage plans still ask you one health question. That's if you have end-stage renal disease. So to answer the million-dollar question that I get asked almost every day, why is there health questions? I thought Obamacare got rid of that because you're right, Obamacare did. Obamacare has nothing to do with Medicare. Okay. Essentially, folks, Obamacare did away with the health questions, but it also put restrictions on insurance companies that they could not do business across state lines, and that also hurt the insurance companies. So each program is specific for each market. And so in some areas, the insurance companies do really bad, and in other areas, the insurance companies do really well. And that's why, because of all these restrictions, even though Obamacare plans, insurance companies that offer Obamacare plans charge such a hefty premium for their plans, they still end up in the red because of how Obamacare has been constructed. And that's why you see so many insurance companies exiting the marketplace. That's why there's very few insurance companies available that offer Obamacare. But point blank, and keeping it simple, Obamacare is for people under the age of 65. Medicare is for people over the age of 65. With Obamacare, typically you're looking at, unless you have some type of subsidy from the government, you're looking at high deductibles, $5, $6, $7, $8, $9, maybe even $10,000 deductible before they will pay for anything. That's normally the way it works. Sometimes those deductibles could be as low as $1,000 or $2,000 or $3,000, but the lower the deductible, the higher the premium. Pretty simple. The older you are, the higher the premium as well. Also very simple. And Obamacare plans, for the most part, are completely conducted and completed through the marketplace. Medicare plans are completely different. You have a couple choices of the different types of plans you have available to you. You have Medigaps or Medicare supplements, and you have Medicare Advantage plans, and both of those could not be more different than an Obamacare plan. It's pretty simple, folks. They have nothing to do with each other. Just remember, one's for under the age of 65, one's for over the age of 65. And stay with me into segment 3, where we will wrap this up. Thank you for being here. Everything Medicare Podcast, folks. This is segment 3, our third and final segment of the week. Every single week I bring you one podcast. Now, if you folks want more than one a week, reach out to us on your favorite social media. You can find us on Facebook, Christian Brindle Insurance Services. You can find us on Instagram, Christian Brindle Insurance. at Christian Brindle Insurance, You can find us at Twitter at Christian Brindle with the E cut off at the end because we couldn't fit the whole thing. You can find us on YouTube, Christian Brindle, and watch some of our educational Medicare videos where I explain exactly what the plans look like. And as always, folks, like I was saying, follow us on your favorite social media for daily content. If you haven't already and you'd like to know everything there is to know about Medicare when it comes to making a good decision, if you want to know if you're on the right plan for you, if you're turning 65 and getting on Medicare and not sure exactly what to do, there's two things you can do. The first thing is if you live in Utah, if you live in Idaho, and if you live in Florida, those are the 3 states that we are licensed to do business with and we work with people. Call our office at 801-572-3808. and talk to somebody here and find out if what you're doing is the best thing for you. We'll be able to tell you we're experts in Medicare. It's all that we do. We know everything there is to know about that one thing. And we'll be able to tell you if we can help you or if we can't help you. We'll be honest and we'll be sure to make sure to point you in the right direction no matter what you do. If you don't live in one of those 3 states, there's another thing you can do. We might not be able to help you yet, but we are always expanding and entering more areas. So it's just a matter of time. But for the time being, pick up my book, Medicare Guidance, Picking the Plan for You. It's a beautiful red book with a Medicare card on the front. And folks, it's only $5 on Amazon right now. It's a 50-page book, an easy read, big font. You can get through it in probably a day. And I talk about everything you need to know. Medicare supplements, Medicare Advantage plans, Part D plans, Medicare A and B, everything that you need to know. And you'll be able to know what you want to do, what's best for you, what to expect just by reading that book. Go to Amazon, type in Christian Brindle or Medicare Guidance, or put them together, and you'll be able to find the book. It's $5, folks. For that price, I'm practically just giving it away. And a $5 book can save you thousands of dollars in making a wrong mistake. It's an investment in yourself. And what I always tell people is there's no better investment you can make than in yourself. And insurance is an investment in protecting yourself. So it falls right into that category. Go pick up that book, Medicare Guidance. Guarantee you'll learn so much that you didn't know before. You'll be like an expert to all of your friends, and you'll be able to help them too. Again, thank you for taking part and listening in and being part of the Everything Medicare podcast and listening every single week. We appreciate you, and we are out. Have a great week, and I can't wait to talk to you next week.
Thank you.